and we hope to have some more public information coming out. Our number one goal from the Reuse Committee was to work with higher education, to be able to get some additional higher education into Smith County, Marion proper, with the current campus. And we are close to being able to announce a partnership with Emory and Henry College. We will be applying for a grant through the Tobacco Commission to help support this partnership, which would include the addition of a satellite campus of Emory and Henry. The first program being offered would be Emory's first doctorate program, a doctorate of physical therapy. So those are our plans. That's kind of where we're targeting the current facility, is to be focused on enhancing higher education opportunities for our young children here in Smith County, to be able to keep them here locally or in the region for their four-year degree, and be able to transition them to many opportunities in the way of a College of Health Sciences. And the first step in that, we believe, because of our need for rehab, and we here at Smith County are really the hub for rehab for Southwest Virginia, and we just opened a rehab unit in July, we're going to be able to utilize a portion of our campus for that doctorate program. So a lot of work's been done. We're very close, hopefully, to being able to move forward with those plans, and we're hopeful as that partnership moves forward that there's other opportunities in the way of health sciences that we can continue to offer here, so that we can keep our young students here, our young population here, and be able to transition them over into a healthcare career. So that's our focus, that's our plan, and one portion of the campus is moving forward in regards to that plan. So we're really excited about that.
Lindy, we've talked about folks getting upset, being upset. You grew up here. This is your home. People root for you, and I guess have an expectation of you to take care of our hospital. Question is Mountain States Health Alliance, are these good people?
Absolutely. I mean, absolutely. I've been affiliated with this organization within Mountain States, at Smith County much longer, but within Mountain States since November 2006. A very strong leadership group that are definitely committed to their community hospitals. I think if you look at other systems in other regions nationwide, you would see a model much different than the one we support at Mountain States, and that is the model that supports the community hospital as being able to offer what we can here locally, as much as we can here locally. And we just added the inpatient rehab service. Now, that's a service that is not going to be offered in Abington. That is not going to be offered at Johnston Memorial. We were the site for that because that is seen as one of our strengths. So we are adding that service here effective July. We are also looking at, speaking to this, keeping patients as close to home as we possibly can when it makes sense. We're also looking at a medical oncology model, being able to offer some services to those oncology patients that now have to travel to Abington or to Bristol or into the Tri-Cities, being able to offer services like chemotherapy here locally again. We once offered that many years ago. But by working with a larger system that has resources and where we can have these satellite clinics like cardiology and oncology, those are the benefits that we're going to receive by our affiliation with Mountain States, and being able to offer some of those more specialized services that we can have the numbers to support here locally and that we can do well. So I think it's important that for everyone to know that we're working hard to keep as much here locally as we can. What we offer here, though, we need to be able to do enough of to do it well and to do it with confidence. And that's what our leadership at Mountain States Health Alliance supports. Very good people, good morals, good ethics, a good foundation of leadership there that has been very supportive of this community hospital. We have lost money since we've been affiliated with Mountain States in regards to millions of dollars. However, we understand that we are part of a larger program, and they have been very supportive of us moving in the right direction to make sure that we can support our own community's needs. And that is going to be very important going forward. And I hope and trust that, with this consolidation of OB, with our ability to offer prenatal care here, which we can do well, that people will see that this more regional model, with us not duplicating things where the volume's not there, makes a lot of good sense. And we can have good, strong regional programs. Some of those may be offered at Smith County, some of those may be offered at Johnston Memorial, but that we're working together to create a stronger regional access point for our patients.
Lindy, you've taken some heat over the last few months. We've talked about you being local. Now, how does that affect you when a lot of this comes from folks that you know?
Well, it's been pretty tough, actually. definitely, like some others, shed some tears over this decision. It's not one that we wanted to have to make. And not having the ability to ensure that everyone has the facts and that they understand where we're coming from a leadership perspective, from a quality perspective, from an access perspective. It's been difficult, but we're going to continue to try to, like these programs, get the facts out there, make sure people understand that we're still committed to doing what we can do here very well, and we're very committed to that. And hopefully over time we will regain some of that trust and respect that has been compromised with this announcement. And it has been tough. And I think our whole team, I have 425 team members here that I am very dedicated to. And we've got to make good, strong decisions for those team members in those services where we have the demand. And we've got to make good, strong decisions to ensure that those individuals have good, strong, stable jobs for our future. So a lot of thought has gone into this. I don't want anyone to think for a moment that this was a decision made lightly. Definitely not, but I am convinced it is the right decision for our region and for our moms and for our babies. I am convinced that it is the right decision, and we'll be able to offer a more solid, long-term quality program through this consolidation.
Mountain States Health Alliance, and with your direction locally, how much money are they planning to put into this county with the new facility?
Approximately $70 million investment in this replacement hospital. A lot of thought's gone in to designing the facility, again, making sure that we are meeting the needs of our patients, their physicians, their volunteers, their team members. We are very committed, and this is going to be a huge community addition for us to be able to continue to hopefully build on what we have here in Smith County. And we need a strong healthcare system, and we need our patients and our residents supporting our community hospital.
Lindy, as we wrap up here this afternoon, just put your message in a nutshell for us.
This decision drives a consolidation of a program that through the consolidation we can absolutely ensure this region that we offer the service within a reasonable distance. It's a consolidation of a service. We are prepared to offer and will continue to offer prenatal, post-op care, GYN care. Dr. Humsey and has a huge following, as well as Dr. Clary from a gynecological needs. We are not talking about women's services leaving Smith County Community Hospital. We are talking about the actual birth. But being able to continue to provide women's services here locally, we are committed to that. Digital mammography we just installed here, it's just a huge enhancement in this community for our women. We have general surgeons such as Dr. Bauman and Dr. Hope that are very committed to offering, breast cancer treatment for women who have a need there, as well as urology needs here locally. So I don't want anyone to think that we are moving and shifting away from not offering women's services. It is a portion of the obstetric program that we feel it's a better decision to consolidate. However, in my opinion, the most important part of that is the prenatal care that we are still very committed to offering here locally. So I think that's the message. It's a consolidation. It's still a very reasonable program to be able to offer this regionally, and we will offer it to a much higher level from a quality and safety standpoint by consolidating a service that needs at least 500 deliveries a year to really have the strength behind it.
We've been speaking with Lindy White, CEO of Smith County Community Hospital in Marion. I'll give you the final word, Lindy.
I would, entertain calls, to my office number. Definitely want to be open and transparent to the community, to those particular residents or moms who have questions. Certainly will be available to entertain those here, and anyone who wants to come and meet with me, I am very open to entertaining that at any point in time. I want to get the facts out there and ensure that this is not your community hospital leaving you. We are still here providing a lot of the services that are needed here in the community, and a consolidation of OB we feel like we can do at a much higher level from a quality standpoint. So I'm here and available and willing to speak in addition if there's any confusion or any other questions coming out of this interview.